Hi everyone, my name is Kwekwa. I'm a pharmacist. In this video, I'll be reviewing the medication Metformin, which is arguably one of the most commonly prescribed medications for diabetes worldwide. So in the next few minutes, I'll cover what Metformin is, how it works, proper dosing, side effects, and important safety tips that you should know. Now, quick disclaimer that this video is for educational purposes only and does not replace medical advice from your healthcare provider. Please always consult your doctor or pharmacist before making any changes to your medication regimen. So what exactly is Metformin? Well, Metformin belongs to a class of medications we call biguanides, and it's considered the first-line treatment for type 2 diabetes. That means that typically, the first medications doctors prescribe when diet and exercise alone are not enough to control blood sugar. It is marketed under various brand names like Glucophage or Glucophage XR, Fortamet, and Riomet. Now, the main FDA-approved use is treating type 2 diabetes. Metformin may also be prescribed off-label to prevent diabetes in people at a high risk, a condition we call prediabetes. Now, in other words, it may be used to prevent the progression of prediabetes into full-blown diabetes. Metformin may also be used to manage gestational diabetes as well as PCOS, which is a polycystic ovary syndrome. Metformin is sometimes also used off-label for weight management in certain individuals taking medications that tend to cause weight gain, such as some antipsychotic medications. Now, what makes Metformin special is that it's been around for decades. It's very well studied, and contrary to many myths, it has an excellent safety profile when used correctly. It's also generic, which makes it affordable for most people. Now, let's talk about how Metformin works in the body. Metformin's primary role is to signal your liver to reduce sugar production. Now, your liver naturally produces glucose, especially at night when you are not eating. But in people with diabetes, it often produces too much. Metformin essentially stops this process, thus reducing the amount of sugar that is released into the bloodstream. Metformin also enhances the sensitivity of your muscles and fat cells to insulin, allowing them to utilize glucose more effectively. Now, you can think of insulin as the key that unlocks your cells to let sugar in, which is where you want the sugar, not in the bloodstream. Metformin helps make this key function better. And there's a third bonus. Metformin also slightly slows down the absorption of glucose from food in your intestines, so your blood sugar doesn't spike as much after meals. Now, what makes Metformin unique compared to other diabetes medications is that it doesn't force your pancreas to produce more insulin. This means that it would not cause dangerously low blood sugar levels when used alone. And additionally, most people either maintain their weight or lose a few pounds when on Metformin, unlike other diabetic medications that can potentially lead to weight gain. Now, let's talk about how to take Metformin properly, because this can make a huge difference in how well it works and how you feel. So Metformin is available as a solution and in regular and extended release tablets. The regular tablet is usually taken twice a day, while the extended version is typically taken once a day, typically with an evening meal. Most people start with a low dose, maybe 500 milligrams, once or twice a day, and then gradually increase over a few weeks. Now, here's a pro tip. Unless otherwise directed by your doctor, always take Metformin with food. This is crucial because it significantly reduces stomach upset, the most common side effect. Now, more about side effects in just a moment. If you are taking the extended release tablets, swallow them whole, don't crash, chew, or break them, as this can dump all the medication at once and cause the very stomach upset that you were trying to prevent. Now, what if you miss a dose? Well, take it as soon as you remember if it's close to your usual time. But if your next dose is coming up soon, just skip the missed dose and continue with your regular schedule. Never double up to make up for a missed dose. Now, let's cover some important safety information, because while Metformin is generally well tolerated, there are a few important precautions to keep in mind. The first, kidney function is crucial. Metformin is eliminated through your kidney, so if you have kidney disease or kidney problems, your doctor may need to adjust your dose or choose a different medication altogether. This is why you will need a regular blood test to check your kidney function. Now, I feel this is a good place for me to address one of the most common questions that I hear regularly. Does Metformin cause kidney disease? Well, the truth is that Metformin itself does not cause kidney disease. However, if kidney function is already impaired, metformin can potentially build up in the system, leading to unwanted issues. Now, here are some key precautions that you should know about. If you drink alcohol regularly or excessively, talk to your doctor. Alcohol can increase the risk of a very rare but serious side effect called lactic acidosis. Now, I'll talk more about lactic acidosis in just a moment. Also, if you are scheduled for any imaging test with contrast dyes like certain CT scans, you may need to temporarily stop metformin before and after the procedure. You would also need some routine monitoring, kidney function test every few months initially, then yearly, and then an annual vitamin B12 level check, since long-term metformin use can sometimes lower B12 levels. Now, long-term use of metformin has been associated with malabsorption of B12, hence the need to consistently check your B12 levels to make sure that it is in the target range. Now, one reassuring fact is that metformin generally doesn't affect one's ability to drive or operate machinery, since it doesn't typically cause low blood sugar when used alone. Now, let's talk about some common side effects. The most common side effects with metformin are all digestive: nausea, diarrhea, gas, bloating, indigestion, and sometimes a metallic taste in your mouth. Now, it's estimated that about 20 to 30% of people experience some of these, especially when they first start taking the medication. The good news is that most of these side effects are temporary, and there are simple ways to sometimes minimize them. First, remember the golden rule or the pro tip that we talked about earlier. Always take your metformin with food unless otherwise directed. This single tip prevents most stomach upset. Second, starting with a lower dose and gradually increasing it gives your body time to adjust. Many doctors will start you on 500 milligrams once or twice a day and then slowly increase over a few weeks. Now, if you're doing all this and you're still having stomach issues after a few weeks, talk to your doctor about switching to the extended release version. It's often much gentler on the stomach. For the metallic taste, staying well hydrated and chewing sugar-free gum can help. Now, for the digestive issues, eating fiber-rich foods and staying hydrated often improves things. The key thing to remember is that most people find these side effects improve significantly within 2 to 4 weeks as their bodies adjust to the medication. So don't give up too quickly. Your stomach usually just needs time to get used to the medication. Now, let's talk about some serious side effects. Now, these are rare, but it's important to know what to watch out for. And the most serious potential side effect is something called lactic acidosis, which I mentioned earlier. Now, this is very rare. We're talking about a few cases per 100,000 people per year, but it's serious enough that you need to know what the warning signs are. Lactic acidosis symptoms include unusual muscle pain or weakness, trouble breathing, stomach pain, dizziness, feeling very tired, or an irregular heartbeat. If you experience any of these symptoms, especially several of them at once, seek emergency medical care immediately. Lactic acidosis can be life-threatening if left untreated. Now, your risk is higher if you have kidney or liver problems, if you drink alcohol excessively, or if you become severely dehydrated. This is another reason why regular kidney function tests are so important. Now, if you are taking metformin with other diabetes medications like insulin or sulfonylureas like glipizide or glimepiride, you could experience low blood sugar. Signs include shakiness, sweating, confusion, or a rapid heartbeat. So best practice is to always keep some glucose tablets or juice handy if you're on a combination therapy. And as I mentioned earlier, one more thing to watch for with long-term use is your vitamin B12 levels. Low vitamin B12 levels can cause fatigue, weakness, or nerve problems, but it's easily prevented with regular monitoring and B12 supplements if needed. Now, I want to emphasize that while these serious side effects sound scary, they are quite rare when metformin is used appropriately and monitored properly. Millions of people worldwide take metformin safely every day. Now, I trust you found some value in this video. If you did, please give it a thumbs up, share with somebody else who you think may find it beneficial, and stay blessed, and I'll catch you on the next video. Thank you.